Hi there, my name is Len Nel and I've been using FotoFinders since 2007. A year ago I upgraded to the Vexia and I found it an incredibly useful tool in my practice. What I want to just show you today is the alternative uses for a FotoFinder. I know that my friend Derek Odendaal has given you a very good idea of how well this machine works for seeing melanomas and detecting melanomas. What I'm going to do today is just show you what I use it as an alternative tool. So in my practice, I would say I use the FotoFinder nearly on every patient, and only about 20% of those patients I actually mole map. So the rest of the patients I use the FotoFinder for disease tracking and also for my cosmetic patients. So it's a great way of having photographic evidence. It's easy, it's in your office. You don't have to go in a database and look for patients' photographs. You don't have to get your camera out. It's standing here. It's very easy to take photographs and then to recover them by just using the patient's file number. So it's been invaluable for me in this respect. I'll zoom in on the screen now so that I can show you a few of the ways that I've used this machine. Fine, okay? To start with, this is a patient that I saw who had severe psoriasis. Now, in a case like this, it's good to have the before and after photographs for the patient's sake as well. Also, when you take photographs of this nature, you can motivate for biological treatments, which we did in his case. So there's his before, and let's just go back one, and after. I'll go back one. So the before and after, and it's nice for the patient to see how he's progressing. This was just a normal comedone acne that I saw, and it's nice. He came back a few weeks later and he could see that he had a nice response. This was a patient I saw a long time ago, and I took it with my 2007 FotoFinder. You can see that she improved after a few months, and then after a year you could see the nice result that she had after her Accutane treatment. This is a patient that we used the FotoFinder to make sure that her cosmetic results were fine. She had very delicate tear troughs, and this is difficult to judge if you don't have photographic evidence. So when we did the tear troughs for her, it was a good way of showing the improvement of her tear troughs. It's subtle, but you can see the improvement here, and the patient was happy about that. Another patient I did, just to show, was this man, and you can see he's been married for a long time. He doesn't look happy, and we did some filler in his frown, and he told me that even his wife was happy about that. There you see him from the side profile, that's before, and then we did a bit of filler on him and he looked much happier. Another patient, again you can see we've got a deep nasolabial fold, difficult to remember how bad it was, and she came back later and we could show her that it was looking much better. I'll just go back one, the deep fold, and then that. So for disease tracking and for cosmetic results, it's an incredibly beautiful machine to use, easy to use, and like I said, excellent photograph quality. This is just an interesting case that I had. It was a guy who came in with this little mole on his arm that started itching, and I took an enlargement of it, and what we came up with, it was actually a tick that was dug into his skin there. So very interesting in that regard. Well, that's all I have to say. I hope that I gave you a little bit of an insight on the alternative uses of the machine, but to be honest, I can't see that as a dermatologist in my practice I can function without these machines. Thank you very much.